Healthcare costs are spiraling out of control in our country, and there seems to be no real solution in sight. We're one of the best healthcare countries in the world, and yet our costs continue to go up. One answer may be health savings accounts. And health savings account are something I would recommend if you have a holistic view of taking care of yourself, or if you're an employer and you need to limit costs and not let one person who employs you destroy healthcare for everyone else. Let me tell you a little bit about how they work. First of all, they're based on disaster insurance. So they're trying to make sure that if there's some disaster that you have, you're not bankrupt. So there's a limit, a disaster insurance. Once you go over that limit, might be $3,000 to $5,000. Once you go over that limit, everything is paid for at 100%. So the coverage on the real things that could ruin your family are covered. And this is good because this means it's like having insurance to make sure that you eat, but not having grocery store insurance. The problem with most healthcare coverage is it's like having grocery insurance, and every single time you go to the grocery, they pay your bills for you. The problem with that is, whereas before you were very careful shopping at the grocery store, the minute you have grocery store insurance, you're buying filet mignon and lobster and smoked salmon, and suddenly grocery store prices and spiral out of control because everyone is trying to get the maximum benefit for what is really a fixed payment. Health savings accounts work a different way. In health savings accounts, there is a disaster insurance, and you just have that insurance for when you go over. Everything under that limit, you end up paying for yourself, but you pay for it with pre-tax dollars. And it turns out, if you're like me, before I had a health savings account, I thought, there's no way I can afford to pay out of pocket for everything I do. And yet what I found is, in the first year, what I saved by paying for it myself and not having insurance paid for the entire cost for hitting my deductible one year. So because I'm generally healthy and we didn't have a lot of medical expenses, the savings was tremendous. And now any year I could hit my deductible, and I've already saved a lot more money than that. So now my out-of-pocket expenses change my behavior. Now I ask the question, how much is this going to cost? And I decide whether or not it's worth going to the doctor for it. And when I go to the doctor, I'm looking for a short visit. I'm not looking for an extended visit. And I'm just trying to do those things that are the most likely to help me going forward. So a health savings account for your employees will do the same thing. It will make sure that none of them will get saddled with huge medical bills because there is that cap beyond which they get covered. But it will also make sure that each person has an account. Y'all put some of that money in, and they will be able to cover their healthcare expenses that way throughout the year. So health savings accounts are one way to put in line the person that benefits from a service, the person that pays for the service, and the person that decides whether that service is given is all the same person. And that way the balance and trade-off between different services can be met. So with a health savings account, part of the savings is that the person that pays for an account, the person that benefits from the account, and the person that decides whether or not a service is given is all the same person. And so it unifies everything in one person, and that way that person can make the choices between trade-offs of whether the money is worth the expense. And that will save money in the long run, either for you personally, because y'all be able to decide whether it's worth it or not, or you as an employer, because y'all be able to maintain your healthcare costs across all of your employees.